Your physician has recommended kidney transplant as a treatment for your condition. Kidney transplant recipient surgery is a medical procedure in which a healthy kidney from a donor is surgically implanted into a recipient who has significant kidney damage or disease. There are several types of kidney transplants based on the donor source. Number 1. Living donor transplant. This is where a kidney is taken from a living person. This can be a relative, aka related donor, or an unrelated person, aka non-related donor. Number 2. Deceased donor transplant. This is where a kidney is taken from a person who has passed away and donated their organs. This is the most common type of transplant, and donors are typically registered organ donors. Kidney transplant recipient surgery involves removing the recipient's damaged kidney, if necessary, and implanting the new kidney, along with connecting blood vessels and the ureter. This is done under general anesthesia, ensuring that you are completely unconscious and pain-free during the procedure. Vital signs will be continuously monitored, and your safety will be prioritized by the surgical team. The surgery is an open procedure which is performed via an incision through the abdomen. Kidney transplant recipient surgery typically takes about 3 to 6 hours, depending on various factors such as the patient's individual anatomy, the complexity of the case, and whether the transplant is from a living donor or a deceased donor. The benefit of surgery would include cessation of dialysis, improved quality of life, and decreased long-term mortality. As with any surgical intervention, kidney transplant recipient surgery carries certain risks. These include complications from general anesthesia, along with surgical risks such as bleeding, infection, blood clots, damage to surrounding structures, ureteric stricture and/or leak, rejection of the new kidney, and immunosuppression-related complications and side effects. Your physician will provide you with in-depth information about these risks and address any concerns you may have. An alternative option would be to continue dialysis in the long term, accepting its disadvantages and complications with access issues. Prior to the surgery, you will be admitted to the hospital and receive instructions regarding fasting and continuation of medications that could interfere with blood clotting. Pre-operative tests will be conducted to assess your overall health and readiness for the procedure. The surgical team will thoroughly explain details of the procedure and will address any questions you may have to ensure you are well informed. After surgery, recipients usually stay in the hospital for several days to monitor their recovery and kidney function. In the ensuing weeks, it is common to experience some discomfort and fatigue as your body heals. Rest assured, pain medications will be administered for analgesia. Adhering to the post-operative instructions provided by your physician, including wound care, is crucial for supporting your recovery. Close monitoring of your condition will also be conducted by the transplant team, including laboratory tests and scans. Thank you for your attention. If you have any further questions, please feel free to approach your consulting physician or contact us via these channels.